Hey everybody, Eric from Chandler Physical Therapy here. Wanted to talk today about custom orthotics. We do a lot of custom orthotic fitting out of the office, and one of the main things we want to look at is you want to look at the rear foot, you want to look at the arch, and you want to look at the forefoot as well. And that's where I think a lot of people aren't looking, is at the forefoot when they get custom orthotics. The rear foot's going to be important because it's the first thing to contact the ground when you're running, walking throughout your gait cycle. It should have a certain amount of what we call pronation, or if we look at the back of it, where the heel rotates inward. That's a method for shock absorption and is very important. A lot of people have excessive pronation, and that can become very problematic throughout high levels of activity, walking long term, things of that nature. The arch, obviously, you want your arch to be supportive, but it too should have a certain amount of collapse with it because it's another mechanism of shock absorption. It transfers force from the foot up the chain. Too much arch collapse, however, makes it very difficult to bring the arch back up to a normal height, and we run into problems that way, which creates overuse along with plantar fascia, creating plantar fasciitis or posterior tibial tendonitis. I got it out. When we prescribe custom orthotics, we look at a couple different things. One is the arch height, and then we want to know how much that arch moves. We also want to know the same thing with how much does the rear foot move, because every foot has a normal value with that. If it exceeds that normal value, that's what we want to correct. You shouldn't just prevent pronation, we want to prevent excessive pronation. We also want to prevent excessive arch collapse. We use soles, custom orthotics, and it has a certain amount of prescription that we can use with it. And what I like is it's a video system, a photographic system, that we take 3 pictures of each foot. From that, then I can apply the corrections that I want to do to correct the rear foot, the midfoot, or the forefoot in order to get that fit we like. The one thing I do also like about soles is that it's 3D printed, so it's a full piece. It's not put together by glue. It's held together this way. It comes with a custom shock absorber in the heel, so it absorbs force. And then the resistance is based off of your body weight. And we can create that based off activity level and body weight to the resistance you need. So the shoes you're going to wear for walking may be very different than what you wear for running, as the orthotics might be as well. If you're interested in getting some custom orthotics, or interested in thinking that you might be a candidate for them, we'd love to see you. Give us a call, 480-786-4969, or you can email me at echristiansen@chandlerpt.net. Thanks, guys.